Question 1. A nurse is preparing to administer a medication that requires a double check. What should be done first? A. Administer the drug, then verify with a coworker. B. Document the administration, and then check. C. Verify the medication with another licensed nurse before administration. D. Ask the patient to verify the drug. Answer. C. Verify the medication with another licensed nurse before administration. Question 2. Which action by the nurse reflects safe disposal of narcotics? A. Discard in the regular trash bin. B. Flush down the sink without documentation. C. Waste in the presence of another licensed nurse and document. D. Save for later use if patient declines. Answer. C. Waste in the presence of another licensed nurse and document. Question 3. What should a nurse verify before giving a high alert medication? A. Patient's temperature. B. Last bowel movement. C. 2 patient identifiers and medication rights. D. Time of last visitor. Answer. C. 2 patient identifiers and medication rights. Question 4. Which situation presents the highest risk for a medication error? A. Administering meds to 1 patient at a time. B. Giving meds during shift change. C. Verifying medications with 2 identifiers. D. Using a medication barcode scanner. Answer. B. Giving meds during shift change. Question 5. Which lab should be reviewed before administering enoxaparin? A. Platelet count. B. Sodium level. C. Glucose level. D. White blood cell count. Answer. A. Platelet count. Question 6. A patient asks for a sleeping pill that was not ordered. What is the correct action? A. Administer one from stock supply. B. Notify the provider and follow orders. C. Provide a herbal remedy instead. D. Document it as given for comfort. Answer. B. Notify the provider and follow orders. Question 7. A nurse is administering ear drops. What is the correct method for an adult? A. Pull the ear pinna down and back. B. Pull the ear pinna up and back. C. Insert a cotton ball immediately after. D. Keep the head tilted up for 30 seconds. Answer. B. Pull the ear pinna up and back. Question 8. A patient refuses a morning medication. What should the nurse do first? A. Force administration if ordered. B. Document as refused and notify the provider. C. Mix in juice and encourage intake. D. Hold the medication permanently. Answer. B. Document as refused and notify the provider. Question 9. What should the nurse do immediately after identifying a med error? A. Notify the provider and assess the patient. B. Complete charting for the rest of the patients. C. Blame the pharmacy for the error. D. Wait until symptoms appear before acting. Answer. A. Notify the provider and assess the patient. Question 10. What is the priority assessment before administering a loop diuretic? A. Potassium level. B. Red blood cell count. C. Blood glucose. D. Hemoglobin A1C. Answer. A. Potassium level. Question 11. A nurse is preparing to give an oral liquid med to a toddler. What is the safest method? A. Use a household spoon. B. Use an oral syringe for accurate dosing. C. Mix with baby formula. D. Let the child sip from a cup. Answer. B. Use an oral syringe for accurate dosing. Question 12. Before giving a second dose of an antibiotic, what is the nurse's priority? A. Check the WBC count. B. Assess for signs of allergic reaction. C. Measure urine output. D. Ask if the patient ate. Answer. B. Assess for signs of allergic reaction. Question 13. Which of the following medications should not be crushed? A. Acetaminophen. B. Extended-release tablet. C. Chewable antacid. D. Sublingual nitroglycerin. Answer. B. Extended-release tablet. Question 14. A nurse is unsure about a handwritten medication order. What is the best action? A. Ask a fellow nurse to interpret. B. Clarify the order with the prescribing provider. C. Administer based on best judgment. D. Skip the dose until next shift. Answer. B. Clarify the order with the prescribing provider. Question 15. What should the nurse assess before giving a calcium channel blocker? A. Liver function tests. B. Respiratory rate. C. Blood pressure and heart rate. D. Blood glucose. Answer. C. Blood pressure and heart rate. Question 16. When teaching a patient about self-administered insulin, which instruction is most important? A. Shake the vial before each dose. B. Inject into the same site every time. C. Rotate injection sites to prevent tissue damage. D. Store all insulin in the freezer. Answer. C. Rotate injection sites to prevent tissue damage. Question 17. A nurse prepares a medication but is interrupted before administering. What should be done? A. Leave it at the bedside. B. Label it and continue after the interruption. C. Give it immediately after returning. D. Discard it and start over. Answer. D. Discard it and start over. Question 18. What is the nurse's best response to a patient experiencing itching after starting a new med? A. Apply lotion to the area. B. Document and continue monitoring. C. Stop the medication and notify the provider. D. Offer an antihistamine without a prescription. Answer. C. Stop the medication and notify the provider. Question 19. Which instruction is correct when teaching a patient about using a spacer with an inhaler? A. Inhale quickly and forcefully. B. Press the inhaler, wait, then breathe. C. Inhale slowly and deeply after pressing. D. Exhale into the spacer before using. Answer. C. Inhale slowly and deeply after pressing. Question 20. Before giving digoxin, the nurse must check which assessment finding? A. Blood pressure. B. Temperature. C. Apical heart rate for 1 full minute. D. Bowel sounds. Answer. C. Apical heart rate for 1 full minute. Question 21. A patient is prescribed vancomycin for. Which assessment is a priority during administration? A. Monitor liver enzymes. B. Observe for signs of red man syndrome. C. Assess oxygen saturation continuously. D. Check pupillary reaction. Answer. B. Observe for signs of red man syndrome. Question 22. Which action by a nurse increases the risk for a medication error? A. Administering meds in a quiet area. B. Preparing one patient's meds at a time. C. Leaving a syringe unattended on a med cart. D. Asking questions about unfamiliar orders. Answer. C. Leaving a syringe unattended on a med cart. Question 23. What is the most appropriate action when a patient questions the dose of their medication? A. Reassure them and give the drug. B. Delay administration and verify the dose. C. Ignore the concern if the MAR matches. D. Ask another nurse for advice. Answer. B. Delay administration and verify the dose. Question 24. What instruction is most important when educating a patient about transdermal patches? A. Rotate the site with each new patch. B. Apply to moist skin for best absorption. C. Cut the patch to adjust the dose. D. Use heating pads over the patch. Answer. A. Rotate the site with each new patch. Question 25. A nurse receives a verbal order for a stat medication. What is the best action? A. Wait until the provider writes it in the chart. B. Write it down, repeat it back, and confirm. C. Administer immediately without confirming. D. Ask a colleague to verify it. Answer. B. Write it down, repeat it back, and confirm. Question 26. Which medication error example represents a wrong route error? A. Giving oral medication instead of 4. B. Administering a double dose. C. Giving meds to the wrong patient. D. Giving a discontinued medication. Answer. A. Giving oral medication instead of 4. Question 27. What is the priority nursing action when a patient receiving opioids reports difficulty breathing? A. Encourage deep breathing. B. Stop opioid administration and notify provider. C. Offer water and elevate the head of bed. D. Ask about history of lung disease. Answer. B. Stop opioid administration and notify provider. Question 28. Which strategy enhances safety when administering look-alike/sound-alike medications? A. Rely on color-coded labels. B. Use tall man lettering. C. Avoid patient questions. D. Trust the pharmacy label only. Answer. B. Use tall man lettering. Question 29. A patient with renal impairment is prescribed a nephrotoxic drug. What is the nurse's best action? A. Increase fluids without provider input. B. Administer with food to reduce risk. C. Notify provider and monitor kidney function. D. Give a lower dose independently. Answer. C. Notify provider and monitor kidney function. Question 30. A nurse finds a medication error from the previous shift. What is the first action? A. Ignore if no harm occurred. B. Complete an incident report and notify provider. C. Inform patient's family immediately. D. Wait for next dose to correct it. Answer. B. Complete an incident report and notify provider. Question 31. Before administering a topical steroid, what should the nurse do? A. Wash hands and wear gloves. B. Apply directly with bare hands. C. Mix with lotion to dilute. D. Administer with an oral antihistamine. Answer. A. Wash hands and wear gloves. Question 32. What should the nurse do when preparing to give medications to a patient on NPO status? A. Crush all meds and give with applesauce. B. Hold all medications. C. Check which medications can be given for or with minimal water. D. Give only high-priority medications. Answer. C. Check which medications can be given for or with minimal water. Question 33. Which action is correct when administering an intradermal injection? A. Inject at a 45-degree angle. B. Massage the area afterward. C. Use a 25 to 27 gauge needle and inject at 10 to 15 degrees. D. Aspirate before injecting. Answer. C. Use a 25 to 27 gauge needle and inject at 10 to 15 degrees. Question 34. A patient is prescribed a potassium supplement. What is a key assessment before administration? A. Creatinine level. B. Serum potassium level. C. Bowel movement frequency. D. Hemoglobin level. Answer. B. Serum potassium level. Question 35. Which statement by a nurse indicates understanding of medication reconciliation? A. I only check prescriptions from this admission. B. I compare home meds with current orders. C. I only reconcile meds at discharge. D. Pharmacy handles all med reviews. Answer. B. I compare home meds with current orders. Question 36. A nurse prepares to give a med from a multi-dose vial. What is the correct technique? A. Draw up without cleaning the vial. B. Use the same needle used for mixing. C. Clean the vial top with alcohol before use. D. Store the vial at room temperature without label. Answer. C. Clean the vial top with alcohol before use. Question 37. When is it appropriate to crush medication? A. Always if the patient cannot swallow. B. Only with provider approval for compatible formulations. C. For all extended-release drugs. D. If the nurse thinks it will help absorption. Answer. B. Only with provider approval for compatible formulations. Question 38. A nurse administers insulin lispro. What is the priority follow-up action? A. Monitor for hypertension. B. Ensure patient eats immediately. C. Encourage bed rest for 2 hours. D. Monitor WBC count. Answer. B. Ensure patient eats immediately. Question 39. What is the nurse's role in preventing medication diversion? A. Limit narcotic counts to once a week. B. Delegate wasting to unlicensed personnel. C. Secure controlled substances and document wastes accurately. D. Store narcotics in a med drawer. Answer. C. Secure controlled substances and document wastes accurately. Question 40. A nurse prepares an injection and realizes it's for the wrong patient. What is the correct action? A. Save it in the fridge for later. B. Label it and place on the med cart. C. Discard according to policy and prepare a new dose. D. Give it if the medication is common. Answer. C. Discard according to policy and prepare a new dose. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.